Joining us now to discuss this is Executive Medical Director of Infectious Disease and Prevention at Advocate Aurora Health, Dr. Robert Citrenberg. Thanks for joining us again.
Good morning. My pleasure. So
we just reported the U.S. has broken the record for the number of people hospitalized with COVID, but I think people are confused by these numbers because they keep hearing Omicron is not as deadly as the Delta variant was. Are these unvaccinated people in the hospital? Lay that out for people.
Sure, and it is confusing. So the risk of hospitalization with the Omicron variant's only about 1/3 of the risk from the Delta variant. The problem is the sheer number of people who are infected. So many more full people are infected with Omicron than were with Delta. So that still results in overwhelming of our hospitals, even though for an individual, your risk of being hospitalized is lower. What we are seeing in our hospitals is that it's still primarily unvaccinated people, those who have not been fully vaccinated or boosted, and then some who are immunocompromised. But by and large, if you are healthy and you're vaccinated and you're boosted, your chances of being hospitalized are very low. But the problem is based on the sheer numbers of people who have this disease in the community, in our communities, it's still leading to an overwhelming condition in our hospitals.
Right. And because of what you're saying, it shouldn't be a shock to anybody that the numbers are high here after the holidays. Why is the CDC having this conversation that we should be wearing N95s now, knowing the deficiencies of cloth masks? Why weren't they having that weeks ago?
Or how about 2 years ago? It's a great question. We've known for a long time that the type and quality of mask that you wear makes a big difference. So we've always encouraged people to wear multi-layer masks, medical type of procedure masks. KN95s work great. The problem with N95s is they require fit testing and they're more difficult to breathe with. But a thicker medical type mask that has a good seal around your mouth and nose is preferred, whatever type of mask that you can use to do that. But this is something that should have, in the medical community, obviously been using it for 2 years. It's something that probably should have been discussed earlier. So again, we discourage people from using these cloth masks or the neck gaiters. Just to really use a good quality mask will help not only protect you, but protect people around you if you happen to be infected.
We used to hear a lot about herd immunity with so many people testing positive with COVID. Are we almost there yet? It seems like everybody knows someone who's had it, and maybe it's just mild or even asymptomatic.
Well, Robin, we're certainly getting closer to herd immunity. It's a kind of a moving target because the more contagious the virus is, the higher the threshold is to obtain herd immunity. And this Omicron is so contagious that number needed to achieve herd immunity keeps going up. It's probably about 90% need to get it. And then there's a question of how long does that immunity last? But the good news is that with the rapid spread through the community, we should be able, in some areas certainly, to start to achieve that herd immunity where people don't get infected. The pandemic phase is going to burn out, actually probably shortly, the next few weeks, where we're just going to move towards that endemic phase where we're going to have to just learn how to live with this virus.
All right, Dr. Citrenberg, we appreciate you joining us this morning. Thank you, sir.
Thank you.
Hey, Paul, checking the weather?
Yeah, we're going to see sun